So about 30 years ago, I was having a conversation with my father, and the only word that I remember from the conversation is the word AIDS. We were talking about my favorite uncle, Uncle Butch, who was his brother, and the fact that I can only remember one word from that conversation and not my own reaction of grief really says a lot. I wasn't, as a 7-year-old kid, so concerned or wrapped up with the fact that my favorite uncle, my favorite person in the whole world, was being taken away from me. I was more afraid of that big word. And back then, a lot of people were in the same position. Folks around the country were in a panic because some of our most inspirational artists and some of our most incredible thinkers and some of our favorite people were being taken away from us without much of an explanation. And when you look back at that time, it's no wonder that the artist who will always be known as Prince described it as the big disease with a little name. And it's still an incredibly powerful word. But about 30 years later, we know a lot more about HIV, which is the virus that causes AIDS, and about AIDS. We know how it's transmitted. I think most people here would be able to tell you that it's primarily transmitted through unprotected sex and shared needles during drug use. But not only does everybody nowadays know how the virus is transmitted, science has gotten better, the medications have gotten better, so much so to the point that people who are HIV positive can lead healthy lives, almost as long lives as people who are HIV negative. And there has been a growing movement, and part of my work is to foster this movement, of community partners and public health officials that understand that it is possible for us to end AIDS as an epidemic even without a cure. And so let me explain that for a minute. When you're HIV positive, you have a number of HIV copies in your body. If you're taking medicine and you're stabilized, it's possible, and very likely, because the medicine is so powerful nowadays, that you will become undetectable. That is, if you take an HIV test, you might even come up negative. The Center for Disease Control just recently said that if you're undetectable, if you reach that status, then the virus is untransmittable. So, even without a cure, it's possible to end AIDS as an epidemic, not just in the United States, but around the world. So, 30 years after that conversation that I had with my father, I serve as vice president for community mobilization, and I work at an organization called Housing Works. And judging from that response, some people may know that Housing Works is founded by members of ACT UP, people who aggressively fought back against government inaction at the onslaught of the AIDS epidemic. And if you were listening to that story that I told about my uncle, you might think that that's my primary or sole motivation for getting involved in this work. But I'm a community organizer. That's how I got into the field. And community organizers find inspiration everywhere, and sometimes in unexpected situations. So recently, I'll take you to one. I was in a hospital room wearing roughly the same garb as the last time that I saw my uncle, so wearing a face mask and a hairnet. And a doctor handed me my child for the very first time. And I held that child, and I looked that child in the face, and the first thought that came to my mind was, I hope you bury me. I don't know. Maybe I was thinking a little bit about the tragedy that my grandmother had to go through. She actually buried 2 of her children. Or maybe I was just being a father and being overprotective. Anyway, as I said earlier, I have a lot of conversations with people about HIV and AIDS, not just professionally, but also at parties. And I kind of have to. Whenever somebody says, what do you do? I can't really run away from that. But the fun thing is that I wind up having a lot of conversations with complete strangers about sex and drugs. And it's a great icebreaker. I get to know people pretty quickly. So, Those conversations, though, a lot of times will take different turns depending on what subject matter comes up next. If this person decides that they feel confident enough to start talking a little bit more of the lingo, they might bring up perinatal infections. And for people who are unfamiliar with that, that means that someone is just born HIV positive. It's mother-to-child transmission. Now, there's really not a lot of room for joking or for loose talk around there when you're talking about someone who's just born HIV positive. The other thing that tends to happen is any stigma or blame that's associated with how that person became HIV positive goes away. Because all this baby did was be born in a community with less access to health care. Because perinatal infections are totally preventable, provided that you have routine health care and you have quality health care. And from these conversations, I've kind of figured out that people delineate between people who are HIV positive that did something to deserve their status and people who just had the misfortune of being in the wrong place at the wrong time or living in a community without access to health care. The data, though, tells us something much, much different. So if you were to look at data now and look at a group or population of people that have high rates of unprotected sex, you might think that group is going to become HIV positive at a higher rate. It's not the case. And one of the other really, really important pieces of data that I like to carry around in my hip pocket are the results from a systematic review of about 150 studies since 1996, where they looked at health outcomes for people living with HIV. And this systematic review found that the number one predictor for health outcomes for people living with HIV was housing status. So that means that people who are most disproportionately impacted by poverty and by homelessness today are disproportionately impacted by HIV. Now let's go back to the party, because I know that might have been a little bit depressing and heavy. Sometimes we're at the party, a person who I've just started talking about sex and drugs with might say something like, "You work in AIDS? I thought AIDS is over." And it is true, there are a lot of, well, it's true that we don't talk about HIV and AIDS as much in the United States as we used to. Although, I would like to point out, over the last 20 years, the number of new infections has not gone down. It's hovered around the same number, about 40,000. And also when you consider the number of people living in the United States who are AIDS deaths, about 700,000, is on par with the total number of US combat deaths since the United States was founded. That's a lot. We don't tend to think about that very much. 700,000 over the course of a 35-year epidemic. Worldwide, we're talking about 39 million people. What if I were to tell you that last year there were 1 million AIDS deaths? And I sadly knew more than my fair share of those 1 million last year. And I'll tell you right now, they were no less brilliant, no less important. They were at least somebody's favorite person. But the face of the epidemic has changed. It hasn't changed as the numbers. We still have an epidemic on our hands. What has changed is the face of HIV, the face of AIDS. It looks a lot more like mine. It's a lot darker, somehow more easily criminalized, somehow less sympathetic, somehow, some might even say, less than. So, I've been black my entire life, but I won't tell you everything that I've been through. I'll just take you back a couple of years ago. I had a vacation planned in August 2014 and somehow found myself in Ferguson, Missouri. Friends of mine were registering people to vote in Ferguson because they felt like getting community members engaged in local government was the solution to a lot of the problems. I happily signed up. Less than 24 hours after I landed, standing there with a clipboard, about 6 of my friends who are registering people boat, we're all black, and we suddenly find ourselves on the wrong end of a weapon being held by a law enforcement official. Actually 2. One was holding it in the air and the other one was pointing at us. And the person on my left said something I'll never forget, which kind of cut the tension. She said, "It's too early in the day for somebody to point a gun at me." It's about 3 o'clock in the afternoon. The amazing thing, when I go back to that moment, is that we got out without much of a hassle. This is what most people would think, whoa, you had a gun pointed at you, how did you get out of it? You must have thought of something really, really intelligent to say. We just followed the drill. I'm sad to say, but I sometimes understand that my life may be looked at as disposable. Just a few hours before that, I was at the death site of Michael Brown, who was a young man who was shot to death in Ferguson, Missouri in August of 2014. The amazing thing about the death site is that you could not distinguish bloodstains on the asphalt from candle wax that had melted from candles that were burned in his memory. One false step, that's me. I just proposed to my wife, who's now my wife, less than 24 hours before. Would have never seen her again. That is far too common. And I want to point out right now that Michael Brown was shot to death exactly 1 year before I held that baby in my arms. One really, really important thing that I want everyone to walk out of here with is the knowledge and understanding that you can affect change in seemingly insurmountable opposition. I had a friend named James, who in many ways was the face of the AIDS epidemic. He was a black man who was incarcerated for a nonviolent drug offense, and when he got out, he had trouble finding housing because nobody wants to house him. He couldn't find work because nobody wants a felon working for them. He's HIV positive. James buried 4 of his children. They are all AIDS deaths. His last child's deathbed, he said to her, "I'm going to do something. I'm going to do something." I met James shortly after. I moved to New York to run a campaign to help end a discriminatory policy that kept people living with HIV and AIDS cycling in and out of homelessness, putting their lives at risk. There are about 10,000 people who were constantly teetering on the brink of homelessness and possibly of death because they would be then disconnected from healthcare services. And James was one of them, and that's how I met him. James would not stop. He was indefatigable. He just would not give up because his life depended on it. And no matter how discouraged we got, I remember one meeting early on in the campaign that I had with our bill sponsor's chief of staff. And this person says to me, "I don't know why you're working on it. This is impossible." After that, James started singing the Impossible Dream from Manna La Mancha at every rally. And I remember all of us holding hands, tears streaming down our face, because that campaign seemed impossible, but we had no other choice. And we buried a lot of friends on the way. But we won. The way we get to the end of AIDS is by replicating that work, not stopping, standing up against injustice. It's about a year ago, August, to be exact. I was on the road a lot. We were meeting with presidential campaigns to talk to them about joining and bolstering this movement of folks who are working to end AIDS as a coalition. There are about 13 different jurisdictions scattered throughout the United States that are working towards that. New York State is one of them, and we're actually looking pretty good. And I was on my way back from Texas when I heard that James was sick in the hospital. So as soon as I landed, I went and looked for James. I got there a few hours later than his lifespan. And I had it all planned out. I knew James was dying, my friend of 7 years, one of my first friends in New York City. I knew what I was going to say to him, that not only did you do something, look at what you started. People are replicating the work that we did around the nation and now around the world. We did it. But I didn't get to talk to him. I can't talk to James, but I can talk to you. And I'm going to ask you right now to make a commitment that tomorrow you're going to call your assembly member or your senator, or both preferably, and demand that they fully fund New York State's plan to end AIDS as an epidemic. The next thing that I want you to do is call your Congress member and ensure that any changes to our healthcare system result in more people covered, not fewer, less out-of-pocket expenses, not more, and coverage that is the quality of what members of Congress receive. We're almost there. We're almost there in ending an epidemic that has claimed the lives of 39 million and dramatically altered the lives of 78 million people. One of the worst catastrophes in the history of human existence, and to do it without a cure. But we can't get there unless people take up the battle flag for people like James and other people that fell before him and keep marching on that journey to the end of AIDS. Thank you.